I am Priyan Patrin Spilado, a Level 1 nursing student at the University of the Visayas. And in this video, I will be performing my return demonstration for administering parenteral medication. Parenteral medication is given through a route other than the alimentary canal, which are the intramuscular, intradermal, subcutaneous, and intravenous. The route that I will be performing in this video are intradermal, subcutaneous, and intramuscular. Prior to administering the medication, the nurse must consider the 10 rights in giving medication, which are right medication, right dose, right time, right route, right client education, right documentation, right to refuse, right assessment, and right evaluation. So prior to carrying out the procedure, we have to prepare the things and the equipment that we will be needing in parenteral medication administration. So I have gathered here the things that I will be needing in the following procedures. So we have here a vial of sterile water. We have here an ampule of sterile water, a 3 cc syringe, 2 tuberculin syringe, 2 withdrawing needles. I have here a cotton swab and an alcohol, and I have here a tomato because I cannot administer parenteral medication in this return demonstration without the supervision of a licensed nurse. I will be using this tomato, assuming that this is my patient for today. And we will be placing the equipment in a medication tray to make it more convenient for us to carry the medication. And also, we have here a sterile gloves and a face mask to protect ourselves and the patient from possible transmission of microorganisms. Now, let's proceed with preparing medications from ampules. First is to perform hand hygiene and observe other appropriate infection control procedures. This is to prevent contamination and possible transmission of microorganisms. So, I've already washed my hands and I've already donned my gloves. Now, let's proceed to the second step, which is to prepare the medication ampule for drug withdrawal. Organization of necessary items for the procedure facilitates accurate scale performance. So, we prepare here the ampule. So, I am going to clean and disinfect the ampule using the cotton swab and the alcohol. I am going to clean the neck of the ampule. After which, I will flick the upper stem of the ampule several times with my fingernail. This facilitates movement of medication in the stem to the body of the ampule. Now, this can be applied in the glass ampule. Since I am using a plastic ampule, there is no need to flick the ampule. However, for the purpose of compliance in this return demonstration, I am going to show how to flick the ampule, assuming that this is a glass ampule. So, you are going to flick it several times until the medication drips off to the body of the ampule. Next is to place a piece of sterile gauze between my thumb and the ampule neck. This is to prevent from getting cuts from any shattered glass fragments, especially if you are using a glass ampule. So, since I don't have a sterile gauze, I have prepared here a paper towel, assuming that this is a sterile gauze. So, to do that, I am going to place my sterile gauze here in the neck of the ampule. Now, next is to break off the top by bending it away from me to ensure the ampule is broken away from myself and away from others. This protects the nurse's face and finger from any shattered glass fragments. Okay, so I have already here the top of the ampule already broken. Next is to dispose of the top of the ampule in the sharps container. This is to prevent from getting cuts from any shattered glass fragments. Make sure to dispose it properly. So I am going to wrap it with a paper towel and I am going to place it. Ideally, it is placed in a sharp bin container. So assuming I am going to place it here. Now next is to place the ampule on a flat surface. The solution dribbles out when ampule is inverted. So make sure the surface is flat and it is clean and free from contamination. Now, we attach the filter needle to the syringe. A filter needle will reduce the chance of glass being introduced into a medication. But before that, I am going to clean this rubber of the ampule just to make sure that it is free from contamination. Now, we will let it dry for a couple of minutes, and then while waiting, we are going to place the filter needle in the syringe. We are going to keep this original needle because this will be used on administering the medication later to the patient. So I am already attaching here the filter or the withdrawing needle to my tuberculin syringe. Make sure that it is attached tightly so as not to waste or to leak the medication. Now, after which, we will remove the cap from the filter needle and insert the needle into the center of the ampule. The rim of ampule is considered contaminated. Now, use of a needle prevents the accidental withdrawing of small glass particles with the medication. Make sure to keep the cap also because we are going to use this on the disposal later. Now, after we inserted the tuberculin syringe inside the ampule, we will now withdraw the amount of drug required for the dosage. This is to abide by the 10 rights to prevent medication errors and to ensure correct dosage is administered to the patient. So, assuming that the doctor ordered me to administer a 1 ml medication to my patient. Now, I will withdraw a 1 ml medication. Next is to dispose of the filter needle by placing it in a sharps container. The safe use and disposal of sharps will reduce the risk of injury and the acquisition of blood-borne viruses to both staff and patients. So, I am going to get the cap again of the filter needle. I'm going to place it here. Then I am going to remove the filter needle. Now I will dispose it in a sharp bin. Next is to replace the filter needle using the original needle of the syringe. We tighten the cap at the hub of the needle and then we push solution into the needle to the prescribed amount. This is to remove residue from the needle. Change needles after preparation and before administration. So we are going to keep this tuberculin needle with the medication inside the plastic, and we are going to administer and remove this only on the bedside table of the patient. We are going to place it in the tray. Make sure it is free from contamination. Now I will proceed with preparing medication from vials. First is still to perform hand hygiene and observe the appropriate infection control procedures. This is to prevent contamination and possible transmission of microorganisms. Since I've already completed washing my hands and donning my gloves, I will proceed with the second step, which is to mix the solution by rotating the vial between the palms of my hands. Much insulin may not be mixed together, and this is also to resuspend the medication. So, after which, I will place the vial here in the surface and I will remove the protective cap or clean the rubber cap of a previously open vial with an antiseptic wipe by rubbing in a circular motion. The protective cap or the clean rubber cap on the vial protects the self-sealing stopper. It is important to clean the rubber cap to avoid contamination. Now we attach a filter needle to draw up pre-mixed liquid medications from multi-dose vials. Filter needles prevent the Inadvertent administration of small glass fragments when drawing up medications from a glass vial. So while waiting for the antiseptic wipe to dry, I am going to attach the filter needle or the withdrawing needle. Now, since I've already attached the filter needle on my tuberculin syringe, I will remove the cup from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. Before fluid is removed, injection of an equal amount of air is required to prevent the formation of a partial vacuum because a vial is a sealed container. If not enough air is injected, the negative pressure makes it difficult to withdraw the medication. So, assuming that my doctor ordered me a 1 ml of medication, I will draw also 1 ml of air. After which, I will carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Air bubbled through the solution could result in withdrawal of an inaccurate amount of medication. Next is I am going to inject the air into the vial, keeping the bevel of the needle above the surface of the medication. The air injected into the vial will allow the medicine to be withdrawn more easily. Now I will withdraw the prescribed amount of medication, either A or B. A is to hold the vial down, moving the needle tip so that it is below the fluid level. Vertical position makes removal of air bubbles from the syringe easily. Or B, which is to invert the vial, ensuring the needle tip is below the fluid level and gradually withdraw the medication, which is I am doing now. So, inverting the vial prevents air from being aspirated into the syringe. So, after which, we will then put the filter needle into the cup again, and then we are going to remove the filter needle and then insert the syringe again to the original needle, which is used to be administered to the patient for medication. So we will not remove this package unless we go to the bedside table of the patient. And then we will dispose this filter needle appropriately on the sharp bin so that no one will be injured, especially the patient or the collector of the garbage. Now, we are done preparing the medication from the vial and the ampule. Now, I I will proceed with administering intradermal injection for skin test. The first step is to perform hand hygiene and observe the appropriate infection control procedures. This is to prevent contamination and possible transmission of microorganisms. Since I've already done washing my hand and I've already donned my gloves, I will now be proceeding to the second step, which is to prepare the medication from the vial or ampule for drug withdrawal. Because organization of necessary items for the procedure facilitates accurate skill performance. So, since I've already prepared the medication from my previous procedure, which is the preparation of medication from vial and ampule, and it's already prepared here in my medication tray, I will now proceed to the third step, which is to introduce self and verify the client's identity. Introducing myself and verifying the client's identity fosters nurse-patient relationship while doing the procedures. So I have here my patient, assuming that this is my patient because we cannot administer parenteral medication in this return demonstration without a supervision of a licensed nurse. So I have here a tomato, assuming that this is my patient for today. Now I will introduce myself to the client. So, good morning, sir. I am your student nurse for today and I will be injecting you for our skin test. What's your name again, sir? So, assuming that my patient answered, I will also ask the age and the birth date. And after that, you may now proceed to the next step, which is to explain to the client that the medication will produce a small wheal or bleb. Explaining rationale increases the patient's knowledge and reduces their anxiety. So, good morning, Mr. Tomato. So, today, upon injecting you for our skin test, this procedure will produce a small bleb, and then after that, I will withdraw my needle and then I will wait for any allergic reaction. So, after explaining, I will now proceed to the next step, which is to provide privacy. This is to preserve the client's identity. Make sure that upon doing this procedure, the room is closed and the curtain are pulled down to provide client privacy. Now we select a site for injection because good visualization is necessary to establish the correct location of the site and to avoid damage to tissues. So, after I select a site, I will now then cleanse the skin at the site using a firm circular motion, starting at the center and widening the circle outside. Because cleansing the injection site prepares it for the injection. This method removes pathogen away from the injection site. So, in this step, I will be using a cotton swab and the alcohol, and then we will do a circular motion starting from the inside to the outside. After which, we will then remove the needle cap while waiting for the antiseptic to dry, because alcohol gives full play to disinfect after dried. So, I will remove the needle cap from the tuberculin syringe which we prepared on the previous procedure. So after I remove the needle cap, I will then expel any air bubbles from the syringe because this removes air from tubing that can, in larger amounts, act as an air embolus. Now, we grasp the syringe in our dominant hand close to the hub, holding it between the thumb and the forefinger. This position keeps my fingers off the plunger, preventing accidental medication loss while inserting the needle. Now, we hold the needle almost parallel to the skin surface, with the bevel of the needle tip up. This technique lessens the risk of accidental needle stick and also prevents inadvertently unscrewing the bevel from the barrel of the syringe. Now, with the dominant hand, we pull the skin at the side until it is taut. This makes the tissue taut and facilitates needle entry. You may minimize the patient's discomfort by doing this. And then, we insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. This angle ensures you will enter muscle tissue. Now, we stabilize the syringe and needle, inject the medication carefully and slowly so that it produces a small wheal on the skin. Rapid injection of medication can lead to speed shock. And then, we withdraw the needle quickly at the same angle on which it was inserted. Slow needle withdrawal may be uncomfortable for the client. And also, we do not massage the area. We do not massage this because of the medication's anticoagulant action. And then, after which we have already completed the intradermal injection for skin test. And then we will just wait for the reaction of the patient on the drug that we injected to his or her skin. Now I will proceed with administering a subcutaneous injection. The first step is to perform hand hygiene and observe the appropriate infection control procedures. This is to prevent contamination and possible transmission of microorganisms. Since I've already done washing my hands and donning my gloves, I will now proceed to the second step, which is to prepare the medication from the vial or ampule for drug withdrawal, because organization of necessary items for the procedure facilitates accurate skill performance. So, since I've already prepared the medication during the previous procedure and already placed it here in my medication tray, I will now be proceeding to the third step, which is to introduce self and verify the client's identity, and also provide privacy, because introducing myself and verifying the client's identity fosters nurse and patient relationship while doing the procedure. So, since I still cannot administer a subcutaneous injection or any parenteral medication during this return demonstration without the supervision of a licensed nurse. I have here a tomato, assuming that this is my patient. So, I'm going to introduce myself to the patient. So, good day, Mr. Tomato. I am Priyan, your student nurse for today. And today, I will be administering a subcutaneous injection. So, next is to assist the client to a comfortable position. This is to provide clear visualization and easier contact with when administering subcutaneous injection. Next is to explain the purpose of the medication, including relevant information about the effects of the medication. Explaining rationale increases the patient's knowledge and reduces their anxiety. So, Mr. Tomato, today I will be injecting subcutaneously, and then this medication is for you to strengthen your immune system. This might hurt a little, but it will just be really quick. Is that okay with you, sir? Okay. So, assuming that my patient answered me, I will now proceed to the next step, which is to select a site free of tenderness, swelling, scarring, itching, burning, or localized inflammation, and one that has not been frequently used, because nodules or lumps may indicate a previous injection site where absorption was inadequate. Now, we put on clean gloves. This promotes safety from any pathogens. So, I already have my gloves on. The next is to clean the site with an antiseptic swab. Start at the center of the site and clean in a widening circle to about 5 centimeters or 2 inches and allow the area to dry. Because cleansing the injection site prepares it for the injection. Cleaning in a circular motion removes pathogen away from the injection site. And alcohol or spirit gives full play to disinfect after dried. Okay, so while waiting for the antiseptic swab to dry, we will now place and hold the swab between the third and fourth fingers of non-dominant hand. This allows for easy access to dry gauze after injection. We place it between the third and fourth. Here. And then we remove the needle cap from the syringe by pulling it straight off. This technique lessens the risk of accidental needle stick and also prevents inadvertently unscrewing the needle from the barrel of the syringe. So, I'm going to use this medication. Now we hold syringe between thumb and forefinger of non-dominant hand. This position keeps my fingers off the plunger, preventing accidental medication loss while inserting the needle. Next is we pinch skin with non-dominant hand. Pinching is advised for thinner patients in order to lift the adipose tissue up and away from the underlying muscle and tissue. So, we're going to pinch this. Then, inject with bevel up. And then, we inject 45 degrees, 45 to 90 degrees. And then, we release the skin. Release the pinch when the needle is inserted to avoid injecting into the compressed tissue. And then, we grasp the lower end of the syringe with non-dominant hand and position dominant hand to the end of the plunger. We do not move the syringe. This is to prevent movement of the syringe. Okay? Next is to pull back on the plunger to ascertain that the needle is not in a vein. This is to prevent the patient from having hemolysis or rupture of the cells or collapse of the vein when pulling back on the plunger. Now, we quickly withdrew the needle while applying pressure with the antiseptic pad. Withdrawing at the same angle prevents tissue damage and increased pain at the injection site. And also, this will also help control bleeding and better allow the blood to clot over a wound. Now, we assist the client to a comfortable position. This is to provide patient's comfort. And then, we discard the uncapped needle and syringe in a disposable needle container because most accidental needle sticks occur while recapping needles. Proper disposal prevents injury. So, we are going to dispose this. In the sharp, ideally we place it in a sharp bin. So assuming that I have here a sharp bin, so I am going to throw and dispose this used syringe in this bin. So, after which, we will then remove gloves and wash our hands. This is to prevent the spread of infection. So after performing hand hygiene, we will then document all relevant information because documentation provides coordination of care. And now we're done administering a subcutaneous injection. Now I will proceed with administering intramuscular injections. There are various sites for IM injections, which are the ventrogluteal site, the vastus lateralis site, the dorsogluteal site, the deltoid site in the rectus femoris site. So, now, let's begin with the first step, which is to perform hand hygiene and observe the appropriate infection control procedures. This is to prevent contamination and possible transmission of microorganisms. So again, since I've already completed washing my hands and donning my gloves, I will then proceed to the second step, which is to prepare the medication from the vial or ampule for drug withdrawal. Because organization of necessary items for the procedure facilitates accurate skill performance. And again, since I've already completed the preparation of the medication from the vial or ampule in my previous procedures, and the medication is already placed here in my medication tray, I will then proceed to the third step, which is to provide privacy. This is to preserve the client's identity. Next is we introduce ourselves and we verify the client's identity. Because introducing myself and verifying the client's identity fosters nurse-patient relationship while doing the procedure. So again, since I cannot direct them on an actual patient for this parenteral medication, I have here a tomato, assuming that this is my patient for today. So, I am going to introduce myself to the client. So, good day, Mr. Tomato. I am Priyan, your student nurse for today. And today, I will be administering a intramuscular injection via the deltoid site. Is that okay with you, sir? Okay, sir? So, after I introduce myself and I verify that I got the correct client, and assuming that my client answered me today, I will then proceed to the fifth step, which is to assess the client to a position depending on the chosen site. For vastus lateralis, we lie flat or supine with knee slightly flexed. And for ventrogluteal site, we let the patient lie on side or back with knee and hip slightly flexed. And for dorsogluteal site, we lie prone with feet turned inward or on side with upper knee and hip flexed and placed in front of lower leg. This will allow the nurse to access the appropriate site for intramuscular injection. Next is we explain the purpose of the medication, including relevant information about the effects of the medication. Explaining rationale increases the patient's knowledge and reduces their anxiety. So, okay, Mr. Tomato, today I am going to inject via your deltoid side and intramuscularly to give vaccination to strengthen your immune system. Is that okay with you, sir? So, assuming that Mr. Tomato answered me, I will then proceed to the next step, which is to select a site free of skin lesions, tenderness, swelling, or localized inflammation, and one that has not been frequently used, because nodules or lumps may indicate a previous injection site where absorption was inadequate. Now, we locate the exact site for injection. We collect site identification decreases the risk of injury. So, and also, good visualization is necessary to establish the correct location of the site and avoid damage to tissues. So, assuming that I've decided to select the deltoid site. So, we then put on the clean gloves. This promotes safety from any pathogens. So, after I choose a site and then I put on the gloves, which I've already have here, we then proceed to the next step, which is to clean the site that I've selected with an antiseptic swab. We use a circular motion starting at the center and move outward about 5 centimeters or 2 inches and allow the skin to dry because cleansing the injection site prepares it for injection. And cleaning in a circular motion removes pathogen away from the injection site. Alcohol also gives full play to disinfect after dried. Now, while waiting for the antiseptic to dry we will then proceed to the next step, which is to remove the needle cover and discard without contaminating the needle. This technique lessens the risk of accidental needle stick and also prevents inadvertently unscrewing the needle from the barrel of the syringe. So, I have here a 3 cc syringe. I've already removed the cap and the needle is already exposed. After which, we will use the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters or 1 inch to the side. Because pulling the skin is advised for thinner patients in order to lift the adipose tissue up and away from the underlying muscle and tissue. So, assuming that this is the arm near the deltoid side of my patient, we are going to use our ulnar side of the hand and then we will push it to the side. This is how it is done. And then, we hold the syringe between the thumb and forefinger of the dominant hand. And then, we inject needle quickly and firmly at a 90-degree angle and insert the needle into the muscle. So, the position keeps my fingers off the plunger, preventing accidental medication loss while inserting the needle. And a quick insertion is less painful. This angle ensures me that the needle will enter the muscle tissues. And then, after which, you will then release the skin. And then, because releasing the pinch when the needle is inserted is done to avoid injecting into compressed tissue. Now, we hold the barrel of the syringe steady with our dominant hand and then aspirate by pulling back on the plunger with the dominant hand and then aspirate for 5 to 10 seconds. So, a blood return indicates IV needle placement. Possibly, a serious reaction may occur if a drug intended for intramuscular use is injected into a vein. Next is we slowly inject the medication. Rapid injection may be painful for the client. Injecting slowly reduces discomfort, allowing time for the solution to disperse in the tissues. And then, we quickly withdraw the needle while applying pressure with a dry sponge. Because slow needle withdrawal may be uncomfortable for the client. So, we have to do it quickly. After which, we assess the client to a comfortable position. This is to provide patient's comfort. Next is to discard the uncapped needle and syringe in a safe receptacle. Most accidental needle sticks occur while recapping needles. Proper disposal prevents injury. So, I have here the syringe that I use, and I will throw it. Ideally, you have to throw it in a sharp bin. So, assuming that this is my sharp bin, I will be disposing that syringe here. Now, we remove gloves and wash our hands. This is to prevent the spread of infection. Now, after performing hand hygiene, we will then document all relevant information because documentation provides coordination of care and site rotation prevents injury to muscle tissue. Now, I am done administering intramuscular injection. And that ends my return demonstration for administering parenteral medication. Thank you for watching.